but this is the same for women, almost whichever group you look at. And basically what this tells us is that as weight increases within a population, then the risk of dying or death increases. So this is basically men at the age of 50. This is the body mass index that I told you. Remember, 20 to 25 is ideal. And this on the y-axis is how likely you are to die at this age or as your age goes on. As you can see, as soon as you get from above 25, the risk increases. When it gets to 30, it's greater, and up to sort of 40, greater still. So clearly there is a medical reason why these terms are used, why we have a cutoff at 25. Cutoff at 30 is significantly higher than 25, and likewise at 40. Now the studies that are done in dogs are less a less grand scale. This one, as you notice, included 50,000 individuals, so it's a very, very big study. We'd have less information, I'm afraid, in dogs and cats, but the information we have suggests that on the whole, dogs that remain overweight throughout their life are likely to live 2 years less than a dog that remains in ideal weight. So 2 years for you or I may not be a lot, but 2 years actually for a dog is quite significant. Okay. It's not just about quantity of life, it's also about quality. And the other major issue with people is that having too much body fat means you're more likely to suffer from various medical diseases. For people, the number one is diabetes, but there's also risk of things like high blood pressure, heart disease, certain types of cancer, arthritis, the list goes on. So that's our list for humans. What about dogs and cats? Well, in fact, there are many similarities. There are some species differences, but if anything, there's more similarity than difference. So both dogs and cats are more likely to suffer from diabetes. Both dogs and cats are more likely to have higher blood pressure, and certain types of cancer, again, occur more often in overweight dogs and cats. Particularly in dogs, and I'd say number one in dogs actually are problems with lameness. So joint problems, bone problems, anything really that leads to a dog limping. We know less in cats here, but the evidence does suggest that overweight cats are more likely to be lame, so the likelihood is the same is true. We see increased risk, particularly of breathing problems. So we don't quite see heart disease, but that's just because dogs and cats don't tend to suffer from heart attacks nearly as frequently as people do. But we do get problems with breathing, things like pancreatitis, incontinence, particularly overweight female dogs can become incontinent, skin problems, again, the list does go on. I'm afraid I don't have time to go through all of these in detail, nor is it necessary. I just wanted to sort of pick up on a couple of things to show you the spectrum of problems that we see. So let me just introduce you to a case. This is George. He's one of our attendees at our clinic. As you can see, he's a middle-aged Labrador, and you probably don't need to be a vet to know that he is, I'm afraid, very, very overweight. Now, interestingly, he did come to Liverpool but didn't actually come initially to attend our weight clinic. He came because he was lame. So he'd actually been referred to one of our orthopedic surgeons. And that's because he had very, very severe arthritis. So these are the x-rays we've got. And again, I'm not expecting you to have much knowledge of reading x-rays, but these are his hip joints here. And just to guide you, this is a ball and socket joint. So this is meant to be the ball of the joint, and it's meant to be nice and rounded and smooth. And you can see actually how gnarled both the ball and the socket actually are. So that's the effect of his arthritis in his hips. Likewise, this is all a little bit angry. You can see all this extra bone here is all parts and evidence that he's got quite severe arthritis. He actually was referred because he needed an elbow replacement. But one of the things we understand is that because he was overweight, the likelihood is that weight was contributing to his arthritis. So it was important we actually got him to lose weight first before he went through his surgery. And over the course of a couple of years, he actually ended up needing 2 elbow replacements, and he needed hip replacements as well. So just an example of a dog and the association between weight and the sort of medical consequences, if you like. Just the other end of the spectrum, something which, if anything, you could argue is less a medical concern, but I think is very much a sort of cosmetic concern, and particularly with cats. Once they get very overweight, they have problems with grooming, and certainly many of the clients that come to our clinic own cats notice and get very, I guess, upset by the fact that their dog or cat is in very poor condition, and particularly when they're very overweight. One of the areas I'm afraid cats can't groom regularly is around their anus area, as you can see. So owners frequently have to actually clean that for him. And often, I guess, it's one of those things, you know, we promote the health benefits of obesity, but actually one of the things that really satisfies the owners most is the moment when their cat has lost enough weight to be able to, if you excuse me the phrase, lick his bum again. That's one of those things that they always remember, that particular day when their cat is losing weight. Now, just to illustrate the point that we do occasionally see morbid obesity in our pets. This is a Siamese cat who was 13 kilos. So we do, I'm afraid, see these cases that really become so overweight they're immobile. And you get similar sorts of consequences to, again, those people that become very overweight. So you may be able to see here, you've got little bed sores effectively. This cat, unfortunately, is unable to walk around too much, so tends to spend most of its time immobile, and actually, again, has developed consequences as a result of that. Okay, so I've talked you through what causes obesity. We've talked you through what obesity actually is and why it's important. Let's just finish up in the last few minutes by talking about how we can try to prevent it. So I guess how we can be a good pet owner and try to make sure that this problem either doesn't occur, ideally, in our pets. So to do that, I just need to come back to this slide I showed you before, and just to remind you what I said, which is that obesity is all about energy balance. So it's caused by a positive energy balance, and that often actually happens, it's often just very slight and subtle over many, many weeks to months to years. It's not something that develops typically overnight. And that's the trouble, because it can creep up on you without you realizing. So remember, it's too much energy intake, not enough expenditure. And remember, calories don't just disappear, they've got to go somewhere, so they get deposited in body fat. How do we switch this balance round? Well, the best thing we can do is to make sure we keep control of energy intake. So we make sure that we do not feed too much. And on the other hand, the easiest thing we can do is actually increase activity. We can't do anything about the baseline, what we call metabolic rate, the basal metabolic rate. That's essentially something the body ticks over. We have no control of that. I guess we can go and live outdoors, and that might increase our heat production, but it's not going to be very pleasant. So by and large, the way we increase expenditure is by increasing and maximizing activity, and that therefore should hopefully keep the energy balance in check. This is just a little bit of a philosophical point. Of those two strategies, which one is it easiest to do? So is it easiest to reduce your intake, or eat what you want and then just burn it up? Well, here's a human example. Let's imagine we eat a Mars bar. How long does that normally take us to do? Probably, if you're someone like me, it takes about 2 minutes to eat a Mars bar, and that's if I'm really being disciplined and trying to slow my intake. What I've done is taken in 60 grams, and that's about 260 calories of energy. If I now wanted to expend that, how long would it take? Well, if I were to walk for an hour at a typical rate, then I wouldn't even have got up to expending enough energy within that Mars bar. So I think that illustrates the point quite elegantly. It's actually easier not to eat the Mars bar in the first place than it is to eat what you want and try to burn it off. You have to be very fit and dedicate a lot of your time to the the activity side of things in order to burn it off. That's not to say it's not important to maximize activity. I think it does help. But bear in mind, actually, if we only were able to do one thing, controlling intake is absolutely vital. So what do we do? Well, it's actually not so much specific types of food. There are certain foods which are less in calories, lower in calories, and that can potentially be easy or easier. But if anything, it doesn't matter too much what you feed, I guess, as long as it's balanced and appropriate for your pet. It's actually how you feed it which is important.